Hello everybody, this is video number 28 of the healthcare bill, and we are still on page 29 dealing with section 1104 in case you guys are following here. And I went a little too fast in the last video and that's why we're going to go over here. What these people have done, there is this thing called the Social Security Act, and this Social Security Act has a whole bunch of sections just like the healthcare bill. Wow. Well, now we're going to be talking about section 1173 of the Social Security Act. Okay, and what they have done is they have added extra things to section 1173. And what they're doing is they're defining what a transaction is in section 1173. And these are the following things that are defined as a transaction in accordance to section 1173. As you can see, they go from A all the way down to J. Now, before the healthcare bill, there was no letter J. Now there is, okay? So I will go down this step by step with you. The transactions that they were referring to are health claims or equivalent encounter information. This is where you actually make a claim to the health insurance company saying, hey, I need such and such a procedure done. Health claims attachments. This is where if you have a statement from your doctor saying specifically what is wrong with you and you attach that to the claim that you're making to the health insurance people that you're with, that's another transaction. Enrollment and disenrollment in a health plan. That is where you fill out an enrollment form and you send it to the health insurance saying, hey, I want to enroll in your health insurance. That's considered a transaction. Eligibility for a health plan. This is where the health insurance says these are the things that you have to be in order to be eligible for our health insurance plan, so on and so forth. Health care payment and remittance advice. Okay, so when the health insurance makes a payment to your doctor or to you for your health care, that's a transaction. Health plan premium payments. This is where you actually pay your health insurance for providing service. The first report of injury. This is where you fill out a form saying this is how you got your injury in the first place, and you send it to the health insurance. Health claim status. This is where the health insurance sends something to you and says whether your claim has been approved or it has been disapproved. Referral certification authorization. Okay, if your doctor is going to refer you to a surgeon, then the health insurance will say whether that's okay or it's not okay. Now they've added on to electronic funds transfers. Anytime you're sending money to your health insurance, or anytime the health insurance is sending money to your doctor or to you, that's electronic fund transfers. Okay. Now, they also added in here a paragraph, and this is the paragraph right here. It's under number 4, okay, and it says requirements for financial and administrative transactions. Okay, these kind of standards are going to be with all the health insurances. Okay, from now on, the health insurance can't be vague about what you're going to owe to what you're going to owe to the doctor and what they're going to owe to the doctor. They have to be very specific, line for line, saying this is what we're going to pay and this is what you're going to pay. And they can't tell you all this after your procedure's done. They've got to tell you this before or at the time of the service. Okay, so they can't beat around the bush and say, "Oh, I'm sorry. We really meant to say you owed this." You're either to be notified before the procedure's done or at the time of the procedure. Otherwise, they can't come back later and say, well, gee, you really owe this. It won't work anymore. Okay? whatever they decide, it has to be comprehensive. They have to make sure the patient understands what they're going to be responsible for and what the health insurance is going to be responsible for. And you're not going to have some kind of interpreter to try to interpret what the health insurance provider, the health insurance company is saying. You're going to know exactly what they're saying. Okay? And they have to give this to you in a timely manner. Okay? And the health insurance has to be very descriptive about what they're doing. They can't give you a bunch of codes and say, well, that's your codes. They have to tell you what those codes mean and so on and so forth. Okay? So, from now on, when you say to your health insurance, hey, I need to have a medical procedure done. How much am I going to have to pay for this, and how much are they going to have to pay for this? How much you guys going to have to pay for this? Then they have to come back to you in a timely manner and thoroughly explain to you without you have to have some kind of interpreter to figure this whole thing out. They have to say, okay, we're going to pay for this, and you're going to pay for this. And they have to take it down step by step with you. They can't give you obscure codes and try to mislead you in any way. They have to tell you specifically what the health insurance is going to pay and what you're going to pay to the doctor. Okay? That's the whole idea on that. Now, let's go back over here. Okay, it goes down to letter G. Okay, okay, now, when we're talking about reduction of clerical burden, in other words, you're not going to have to read through 50 million forms to find out how much your health insurance is going to pay and how much you're going to have to pay. Okay, so you're going to have very easy to read forms. None of that legal mumbo jumbo. Okay. Now, the thing is, this is going to be uniform across every health insurance provider. Okay, so if you're getting statements from one health insurance provider, if you switch health insurance providers, you're just going to get the same type of statement from them too. Okay, one health insurance may not cover as much as the other health insurance, but when you read the statements, they're going to be just as clear. Okay. For the developing of these operating rules, okay, when the secretary helps to develop this kind of stuff, he's going to rely on a qualified nonprofit entity. Now, what that means is there's going to be some nonprofit group that is not going to be influenced in any way, shape, or form by any health insurance provider. Okay, so you're going to have this nonprofit group that's going to set up these rules for these health insurance providers, but they're not going to be influenced in any way by these health insurance providers. They're going to set up the rules, and then they're going to say, this is what you're going to follow. Okay, so the nonprofit group that sets up the rules for the health insurance providers are going to stand and tell the health insurance providers, you don't follow these rules, that's tough cookie. You're gonna have some problems. Okay. Now, the entity that they're going to use has to be focused on administrative simplification. In other words, they're going to make sure that the forms that are sent out are going to be simple for the average everyday reader to read. Okay. And what they're going to do is they're going to talk to the health insurance providers. Okay, this nonprofit group is going to talk to these health insurance providers, and they're going to talk to health insurance companies. They're going to talk to healthcare providers, to vendors, to relevant federal agencies, and other standard development organizations. Okay, it says the entity, and this is the nonprofit entity that I'm talking about, has a public set of guiding principles that ensure the operating rules and processes are open and transparent. In other words, this is not going to be some secret organization coming up with all these rules for these health insurance providers and for all these healthcare providers. Okay, everything's going to be very transparent. And there's not going to be any conflict of interest, because every person that serves in this nonprofit entity will have no connection to any health insurance provider, will have no connection to any doctor. It will just be them. Okay? Okay, now, there was an act developed back in 1996 called the Health Insurance Portability and Accountability Act. Okay, now they had established a bunch of standards for the health insurance companies and for the healthcare providers, and this nonprofit entity is going to build off of that to determine what these health insurance companies and these healthcare providers are going to do in the line of making things simple for the average everyday man. Okay, and this entity, when they do their work, they're going to have a public review periodically of their work. Okay? Alright. So now they give this committee a name. The name of this committee is going to be the National Committee on Vital and Health Statistics. And they will advise the Secretary whether a nonprofit entity meets the requirements under paragraph 2. Oh, okay. Okay. Scratch that. Scratch that. The National Committee on Vital and Health Statistics shall determine whether this nonprofit entity is good enough to set up all these rules for the health insurance companies and for the healthcare providers. Okay? And they'll advise the Secretary and say, hey, this entity meets with all of our requirements. They will review the operating rules developed and recommended by the nonprofit entity. So when the entity comes up with these rules for the health insurance companies and for the healthcare providers, the National Committee on Vital and Health Statistics will review what they came up with and decide whether they're really good or not. Okay? And that's what we're saying here in letter C. This National Committee on Vital and Health Statistics shall determine whether such operating rules represent a consensus view of the healthcare stakeholders and are consistent with and do not conflict with other existing standards. So in other words, whatever standards have already been set up for the health insurance providers and for the healthcare providers, that these new rules will not conflict with those. Okay. And it goes on, this National Committee on Vital and Health Statistics shall evaluate whether the operating rules are consistent with electronic standards and so on and so forth, and they'll submit everything to the Secretary as a recommendation to whether the Secretary should adopt these operating rules and yada yada yada. So, let's get this straight here. We have this nonprofit organization that is going to create all these rules for the health insurance companies and for the healthcare providers to make things simple for the everyday man to read. Then they're going to submit all of these rules to the National Committee on Vital and Health Statistics. If the National Committee on Vital and Health Statistics determine that these rules are okay, they're going to submit them to the Secretary of Health and Human Services, and if he likes them to, they become rules. Whew, that's a lot. Okay, so here's the adoption requirements, effective dates. Eligibility for a health plan and health claim status. The set of operating rules for eligibility for a health plan or health claim status transactions shall be adopted no later than July 1st, 2011, in a manner ensuring that such operating rules are effective not later than January 1st of 2013, and may allow for the use of a machine-readable identification card. Wow, that's a lot of language there. And electronic funds transfers and healthcare payment and remittance advice. The set of... Oh boy, this just gets thicker and thicker. You know what? I think I'm going to stop this video right here, and I will continue this in the next video, so stay tuned.